think we're ready.
So what does everybody think? In what Colorado town is Mike the Headless Chicken Day celebrated? Crested Butte, Fruta, Meeker, Alamosa. Anybody have any guesses?
And you can write your guesses in the chat.
Oh, well, I already put it over there. It's in Fruta because a farmer named L.A. Olson cut off Mike's head on September 10th, 1945 in anticipation of a chicken dinner, and Mike lived another 4 years without a head. And they do have a festival every year in Fruta that's Mike the Headless Chicken Day. I've actually gone to it. It's pretty funny.
Well, thank you, Becky, for getting us, ready for this event. This is a virtual fundraiser, and my name is Sally Boccella, and I am running for Senate District 23, which encompasses Weld, Larimer, and Broomfield counties. And I'm really excited to have. I'm still letting people in. Sorry. And I'm very excited to have my special guests, Representatives Caraveo and Mulliga. So Representative Yadira Caraveo is a pediatrician, and Representative Kyle Mullica is a registered nurse. So tonight we're going to be talking about COVID response and basically looking at COVID through the lens of healthcare professionals. So I ask you to please put your questions into the chat for us to make it a little easier, so that we can go ahead and try and get to all the questions. And I believe my wonderful friend Julie will be monitoring Facebook for us as well to see if we have any questions there. So thank you all for being here. And if you'd like to learn more about me, please visit my website at sallyforcolorado.com. So I'm going to throw it to my guest speakers. Hi, Representative Caraveo. How are you tonight?
Good. How are you?
I'm doing great. Why don't you tell us a little bit about yourself and a little bit basically how was your day today?
Oh, sure.
You work today, right?
I did. I was in clinic. So my name is Yadira Caraveo, and I represent House District 31, which makes up most of Thornton. And I'm running for my second term this year. And when I'm not at the Capitol, as Sally said, I'm in clinic as a working pediatrician. And so today I saw about 20 patients, I think. It's been interesting the entire time since I've been running to balance medicine and campaigning and then being a legislator, but especially in the time of COVID, right, where everything has been so unpredictable, both in the arenas of medicine and the legislature. I think we need more pro-science candidates, definitely, to run for office, because even before this, a lot of the decisions that we make influence medicine, and nobody truly understands how those decisions play out, apart from people who really are practicing it day to day. And so I'm very happy to join you all tonight to talk about coronavirus and how that's affected both areas of my life as a doctor and a legislator. I'm very happy to join my fellow state representative Kyle Mullica, because I think we see things very similarly, being the two healthcare providers in the State House.
Also, please tell us your website just so people have it, or we can put it in the chat.
Yeah, we'll put it in the chat, but it's caraveoforcolorado.com. So just my last name, FOR Colorado.com.
Great, thank you. Thanks so much for being here. Next is our next guest speaker is Representative Kyle Mullica. He's a registered nurse. Hi, Kyle. How are you tonight?
Hey, Sally. Thanks for having me on. And there's nothing better than following a doctor and our only physician down at the Capitol. And so it's my honor to be here with you, Sally. Be here with Representative Dr. Caraveo, and being able to work on healthcare policy down at the Capitol and really bring that frontline perspective. I represent House District 34, which is all of North Glen, Federal Heights, and then parts of Thornton. And so basically 84th and I-25, all the way north up to 144th and I-25. And I'm an ER nurse. And so I have been on the front lines during this pandemic, really caring for people and seeing the effects that this pandemic is having on individuals and on their families. We took a break down at the Capitol during this pandemic, and during that break, I actually went out to Cook County Jail, which was one of the hardest hit areas, and that's in Chicago, to care for COVID patients. And when you're in jail, you really have a tough time socially distancing. And so we had a number of inmates have it, a number of the guards, and actually lost a few of both. And so, this is a real thing that we're dealing with. And I want to echo what Dr. Caraveo said, that we need to really rely on the science and the experts, and rely on our doctors and our infectious disease experts to really battle this pandemic. And this isn't a hoax. This isn't something that's just made up. This is real. And every data point that we hear of someone dying, that's someone's father or someone's mother or someone's aunt, and that affects a family and that affects a community. And so we really need to be doing all that we can. And I'm excited to be here today to share my perspective and what I've been seeing, and to obviously support you as well, Sally. And
thank you.
Everything that I can to get you down at the Capitol so that we can.
Thank you. I really appreciate that. So one of the things I wanted to basically just start the discussion is there's a lot of misinformation out there. Some people are saying, oh, I'm seeing numbers from the state, and then I'm seeing different numbers from the counties. What are your thoughts on that? Either one of you, it's fine. Yeah,
I think that the thing that people have to realize is that we've never seen this before. No, you can talk to the oldest doctors around, and none of us have lived through a pandemic like this before. And so and none of us have seen, this is a brand new virus, that is that we're still trying to learn about and still trying to figure out. And when you're trying to learn about that virus, you're trying to learn about the spread, you're trying to figure everything out. And so there has to be some patience there as well, in trying to figure it out, and understand that when it comes to public health, you don't realize that you were wrong until it's too late. And so it's better to react in a way that is going to stop the spread, and maybe some may deem that as overreacting, but you don't know that because we see the benefits of it, and if you underreact, you see the consequences of that. And so so I think we need to recognize that, and we need to understand that the work that our public health officials are putting in right now is for the safety of our community, and that's the only thing that's on their mind. And it's not political, it's nothing else but making sure our community is safe.
Kyle, I think that I couldn't have asked anyone to articulate that better than that. Wow. Yes, I absolutely agree with you. I think I was just speaking to a teacher today in my school district, and the word that always comes to mind is, moving through this with grace, right? Because it's we're in real time, and this is all happening to us, and we're in this together, and we've never experienced this before. And so there's going to be things that work and things that don't. But I think that we err on the side of caution, and I think that we'll be in a better place when we come out of this. So I definitely think that that's where we need to be. I also wanted to talk a little bit about, so when we talk about the numbers, some of the things that comes to mind in some of these conversations is, well, there's been only X amount of deaths, right? And again, overreacting, things like that. But one of the things that that was brought up to me that I wasn't even thinking about is the people that are actually getting COVID that are surviving and then having to deal with complications. So could you both speak to that so that you can give us a little bit of background on what we're dealing with? Because I know this virus seems to be changing, right? I mean, I don't know if we really understand it fully. So if you could speak to that, that'd be great.
Sure, and I know that Kyle can speak to this probably with much more one-on-one patient experience, because as a pediatrician, we're not seeing a whole lot of it yet. I've definitely had patients that have tested positive, but children are doing fairly well with it, unlike a lot of illnesses. So like the flu, for example, the very young and the very old tend to do worse. But with this illness, and we're still learning reasons why, children are tending to do pretty well with it. But even with that, you know, we talk about it in clinic that every week we learn something new about this virus. You know, first we were saying it's just fever and respiratory symptoms. It doesn't cause GI upset or anything like that. And then we learned, no, it really does, because we looked at the numbers a little bit more closely as more and more people suffered from it. And then we said, you know, children are really doing well with no effects. And then we learned about MISC, which first came out in New York because of the huge number of cases they had. They had enough children who felt ill that now we're seeing this multi-system inflammatory syndrome that is acting a lot like something called Kawasaki syndrome, which we see in pediatrics, not infrequently, which causes inflammation of the vessels right around the heart. So obviously a very, very serious condition where kids present with a really long fever that we can't explain otherwise. And then they get this horrible rash, they get inflammation of their limbs. And when we go to the hospital and do an echo, we find that it's affecting their heart. And so we're seeing something similar with coronavirus, but it's affecting a whole lot more organ systems than just the heart. And then every week, you know, we have new studies that come out. Just a couple of weeks ago, there was a new study showing that even in people who did fairly well with the illness, about 3/4 of them are seeing permanent damage to their heart. And that is definitely something that's going to affect them long term. You know, we have a huge issue with cardiac illness in the United States, mainly because of our lifestyles. And this is really just going to add to it. So the more and more that we learn, as Kyle said earlier, this is the first time in the information age that we have seen a pandemic like this, and that we've had such a concerted public health effort behind something this huge, where all of these agencies across the world can collaborate. And so we're learning more and more every day, but it's still a brand new illness that we'd never seen before. And so, you know, I really commend all of the public health you know, workers and agencies out there who have been doing their best with trickles of information to really take care of us as a whole.
Thank you. Kyle?
Yeah, and Yadira said it perfectly. You know, we're so early in this virus and in this pandemic to even really know what those long-term effects are going to be. And we see some information trickling in around cardiac and what the effects that it has on your heart, you know, which is scary. I think that the scariest thing for me is that when I get that patient into the ER with these symptoms that we're talking about, I can treat those symptoms. I can try to treat your fever. I can give you supplemental oxygen if you need it. We can give you some GI medicine, but I can't cure you. I don't have a cure for this. And as a provider, that is terrifying. When you have somebody that you have to intubate and there's nothing that you can necessarily do that would save their life. And that's why it's so important that we really have to think about our neighbors, and we have to think about our most vulnerable populations. And that's a unique thing about this virus too that we're seeing, is that asymptomatic carriers have it. And so typically when you have your cold and your flu, you're sick, and that's your sign to stay home, stay away from people because you're contagious. With this, we have a significant amount of people that are carriers that aren't showing any symptoms at all, that are unknowingly spreading the disease or the virus. And you know, that increases this level of that makes this even more scary than it already is. And so this is a serious thing that we have to take care of. You know, like I talked about earlier, you know, we're up to how many deaths now that we're at. I think we're, you know, the number of people that have died in the United States has you know, surpassed the number of people that died in World War I. You know, and every one of those data points is somebody's family member. And so, you know, we need to take that responsibility on ourselves. And that means that we need to be wearing masks to try to limit the spread of this, socially distancing when we can, and practicing good hygiene and washing our hands. So So that's what I'm seeing. And, I just, hopefully I convey how scary it is as a provider right now, because we don't have as many tools in our tool chest as I would like to see to really take care of these people.
So there's two things that I wanted to, you both mentioned. So for Kyle, you mentioned masks, and I really do want to visit that. So the governor was forced to do a mandate on wearing masks in public, and we are getting a pushback on that. So can you speak a little bit to that? I mean, I think that if a person is like, they're looking at these numbers and they think, oh, it's all good. Or they think, I'm healthy, this is just a virus. Maybe I don't need to wear a mask. Just kind of speak to us from your perspective as a healthcare professional, what it means to wear a mask for not only ourselves, but for our neighbors, right? During this time.
Yeah, no, it's so important, and it plays such a huge role. And we have the data to show how many lives it saves when we have compliance in wearing masks. And, this idea that masks don't work, or that, you can't breathe with a mask on, or that your oxygenation level, it's just flat out false. And the thing is before this pandemic, working in the ER, we would get immunocompromised patients that would come in on a regular basis, and they may be on chemotherapy or whatnot, but their system was compromised, and so we had to do all that we could in the ER to protect them. And do you know what I did? What I have to do when I have an immunocompromised patient in the ER? I put on a mask before I walk into that room, because I need to protect that patient from anything that I may have. And so this isn't something that's new. This isn't something that we've pulled out of thin air and made up. This is something that is scientifically proven, will protect people, and it will protect yourself. And so, getting back to the idea that we need to be good neighbors and that we need to be doing all that we can to protect our most vulnerable, wearing a mask is one of the best ways that we can do that, and a small sacrifice to make sure that members of our community aren't catching this and dying.
And I also think too, it helps with the spread, because I was talking to my provider, and she was saying that that's one of the things about COVID. I mean, she says, we stress, like, don't be afraid if you do have it, if you think you have it, but that is one of the things that's highly contagious. The thing is that when you're wearing a mask, like you said, Kyle, you're protecting your neighbors, and you're also preventing it from spreading as quickly as it could if you didn't wear the mask. And then we overwhelm our healthcare providers, and then we're in a real mess, right? Because then if we all need those services and they can't provide for us, then what? So thank you. And Yadira, I wanted to speak a little bit about, you mentioned children. So school's about to open, school's about to start. And, school and that, starting school is on a lot of people's minds right now. There's a lot of anxiety around starting school. Some parents are, really want to send their child back to school. And for, some of them, like I said, they have valid reasons, right? For socialization, because their child learns better in person, all valid issues. But again, we're in a pandemic. So I guess what I wanted to ask you was, what are your thoughts, because you are a pediatrician, in regards to, when we think about sending our child to school, if it is a hybrid situation. I can tell you that I'm a substitute teacher, and so I have 2 public school students, and I actually decided to do full-time online for both my students, and then also I'm a sub for online teachers. And that was something that was in my power as a parent, right? But like a lot of teachers don't have that. They're not in control of that, or other parents maybe. So I just want you to speak a little bit to maybe the vulnerability, or some of the ways that we as parents who are sending our children to school can really help in regards to keeping this pandemic under control, so that our children could go back to school and our teachers are safe. Yeah, what are your thoughts on that?
Sure. I mean, this is the question that I've been getting really for the last month and a half or so in clinic with any school age kid. And it's hard to know, right? Once again, everything is shifting. And just when we think that we have a good answer or a good recommendation, then new data comes out that questions whether we were, relying on the best assumptions. And so, for example, for children, what I had been telling people is all of the data was showing that if you're under 10, your risk of both getting coronavirus and then transmitting it to somebody is much lower than if you're over the age of 10. So one of the reasons that we think that children don't get this illness as much as adults is because they don't have the right receptors in their nose. So there's these ACE2 receptors that is really what the virus is attaching to, and children just don't have as many of them. So there have been studies showing that kids who have the illness have just as many viral particles in their nose as an adult does, but they're either asymptomatic or very mildly symptomatic because the virus just can't get in to do the damage that it does to adult cells. So what I had been telling adults or parents in clinic was if your kiddo is less than 10, so like in elementary school, and you don't have any family members who are high risk in your home, so nobody that's over the age of 65 or has something like diabetes or COPD or anything like that, then for those kids, the benefits of being in school in person might outweigh the risk that there will be a transmission of coronavirus, because in all likelihood, if they get sick, they're going to do okay. And if your parents are young and healthy, then you would probably do okay. It's a different story for anybody over the age of 10. They're much better at transmitting it, about as effective as an adult. They have much better cough, much stronger coughs, and so they can spread the illness much more easily. And they're also better able to adjust to online schooling, right? They've been in front of screens for much longer. And so for many of those kids, it may be worthwhile to stay home because they're going to reduce the risk of transmission to other people in the household, especially if, say, they have a grandparent living with them or mom or dad has diabetes. Now, that was all what I was saying last week. And since then, the American Academy of Pediatrics came out with a study showing that over 100,000 kids have gotten coronavirus in recent months. So our data about how many kids were actually getting it may have been skewed by the fact that they're not getting quite as sick, and so they're not being tested as much. So that kind of throws a wrench in what we've been thinking. At the same time, some of the schools in Georgia that have opened up, I think we've all seen the pictures of the incredibly crowded hallways there. They have had a couple of instances of more serious illness. So it may be that children are actually transmitting this more than we thought that they were, especially, and really excuse me for saying this, but through their stool. But, I'm a pediatrician. We talk about stool all day, so I apologize.
No. We want to know these things.
And so once again, the data is shifting. Right now, I'm saying to families, really do a risk-benefit analysis, basically. We do that in medicine all the time, right? What's your risk versus your benefit? But still, I think that for younger kids, if there's nobody high risk in the house, imagine having a kindergartner learn online. I really don't know how teachers do it. My hat's off to everyone in your profession. But it's really something that every single family is going to have to decide one-on-one based on what their family looks like and what their risks are.
So in regards to that, if a child does get it, so you're saying that, say for instance, I have a 7-year-old and they get it. So the chances of them infecting their household is really low? It's
lower. So we were thinking pretty low. Now we're saying, well, maybe it's a little bit higher than we thought it was, but still much less likely that they'll transmit it than a 17-year-old or a 27-year-old.
Okay, that's really great. Thank you so much. I'm sure there's a lot of parents watching this that are like, oh, I'm really grateful for that information, because again, we're not experts, and so we're learning this too, and it's really great to have you explain that to us. Thank you. Kyle, did you want to add to that?
No, I think that, Dr. Caraveo she's working with kids. I deal with the adults in the ER. Kids scare me a little bit. But no, I think we need to still, be cautious. I think that something that I'm concerned about working in the ER, having kids of my own, is I know everything that they bring home, and how the house usually gets sick right around the start of school. And then I also recognize that we're coming up on the flu season. It's right around the corner. Flu has the same symptoms that we're seeing with the coronavirus. And that's going to be really concerning to me too, to try to figure out how our system is going to deal with if we end up having a bad flu season in combination with what we're dealing in this pandemic.
So you mentioned symptoms. I'm curious, what can you basically lay it out for us? What are the differences between the coronavirus or COVID-19 versus the flu? Because I think that comes up a lot too. It's just like the flu. Can you explain to us how that they may be different or similar or both?
Yeah, they're really similar, and it's tough sometimes to figure it out, the difference. The GI stuff is somewhat unique. You're fatigued with coronavirus, respiratory issues, cough, fever, headache, and all of those can translate, between the two. I think the two big things that we're seeing that differentiates that, really guarantees that it's coronavirus and not going to be a flu is that loss of taste and smell. Is one of the big things that we're seeing, I think with coronavirus, what we're seeing potentially with the more serious cases is they deteriorate pretty quickly. Your oxygen level starts going down, and you don't typically get that with a common cold or flu. You just feel really, really crummy. But it's going to be difficult to try to differentiate between the two of them. And it's going to be difficult too, because a lot of people seek care in the hospitals when they're feeling crummy and when they have that flu. And the hospitals are already being pushed to their limits in the capacity and the resources that they have in dealing with this. And so, I think that it's going to be imperative that that we have a strategy at our system level on how we're going to deal with that and what it's going to be. And it's important. It's important to obviously to get your flu shot to try to prevent and limit the amount of people that contract the flu as well. I'll just advocate that.
So in regards to strategy, so that we don't overwhelm the hospitals, do you suggest that if they do have those symptoms, they go to their provider, correct? They go to their provider first or urgent care, and then from there they would get tested, and then hopefully either they don't need to be hospitalized, like hopefully. Let's talk a little bit about testing. So either one of you can speak to that. The governor was just on. There's 2 new sites for free testing. That's really exciting because obviously, some people are paying for their tests and they shouldn't be. But the more tests that we have out there, the more we know more about this, right? I think that's the other thing that skews the numbers. And you said that, Yadira, was we don't know, right, until we have all the testing. And if you don't get the tests, then your numbers aren't accurate. So speak a little bit about testing, COVID testing, and I noticed that there's another thing with that. So some tests come back within 14 hours or 24 hours, and then other people are saying that they're not hearing back for 3 to 7 days. Can you speak to that too?
Yeah, so the state and the counties have been able to work together to get these 2 new test sites up. One's at Waterworld, which is in my district, and another at the Aurora Sports Complex, and to really use some of the CARES money that came in to, make sure that people were able to get tests and had adequate access to tests. And testing is very important, you're right, Sally, in trying to combat this pandemic. But just as important as that test is making sure that we get a timely timely result back, which we weren't getting with other testing sites and private sites. You know, it was 8 to 10, sometimes even 12 days out. And by the time that happens, then actually the results are useless and really has done no good. And so in these testing sites that we have set up, that the governor and the county commissioners have worked on setting up, those test results should be back within 2 to 4 days is what we're being told, which is much better than what we're seeing, and helps with contact tracing and making sure that we're tracing how this disease is being spread and being able to inform people so that others can adequately take care of themselves. And so it's a big piece.
Okay. Yadira?
Sorry, I was looking at one of the questions in the chat and trying to find some information on the breakdown of which kids have tested positive over the last couple of weeks of those 97,000. So I apologize.
No.
But in terms of testing, I think that some areas, and we saw this, have seen this from the start of the pandemic with different responses to illness. Some areas of medicine are really being overutilized and some are being underutilized. And I think as you implied earlier, not everybody has to go to the emergency room, right? You still have your private physician, whether it's an internal medicine, family medicine, pediatrician, et cetera, who takes care of you primarily, who in many instances has the ability to test you in a system that is not the state lab, which is overwhelmed right now and is not, driving down to the Pepsi Center to get a swab done. So for example, we in my clinic right now we're testing through the Children's Hospital, and the Children's Hospital is they're promising a 24-hour turnaround, and it's really more like 12 hours. Now you have to know a doctor who has that association with Children's, right? You're not going to get that through, driving down to the Pepsi Center. If that is your only option because you either aren't established with a doctor or you're not insured, and so you can't, you don't want to pay for the testing, you shouldn't have to pay for the test otherwise, then the Pepsi Center is a good option. But I think a lot of people are really forgetting that their doctor is a really good resource. And actually doctors' offices, for the most part, are small businesses, and they actually saw huge slumps in the number of patients that they were seeing, especially at the height of the pandemic, because people weren't seeing them. They were going to emergency rooms, or they were getting tested through other sites, urgent cares, et cetera. And forgetting that your most important asset as a patient in this country is your primary care doctor.
Great, thank you. It's really important, yeah. Because I think the whole reason that we're trying to flatten the curve is so that we don't overwhelm our hospitals. So, and I think right now, so Kyle, you currently work in a hospital. So right now, how are we doing? Let's just use your hospital as an example. How are things going right now?
We're seeing an uptick. We definitely are seeing more people come in. I can only speak from the hospital that I'm working at, but the population seems to be younger, which is, necessarily not as bad as the older population coming in, because we were admitting quite a few people with it. But we are seeing more people come in, and that's concerning, because if they are coming in, then they're testing positive, then there is the possibility that they're spreading that disease to more vulnerable populations that may not have the same outcome that they're having. And so we're definitely seeing an increase in traffic, and it's COVID related, some of it, but some of it is typical ER traffic, which is a good thing. I think it was something that was concerning a lot of us in the emergency room, that we weren't seeing the heart attacks come in, the strokes come in, and those types of things, which was telling us that maybe people weren't seeking out the care that they needed in emergency situations. And so it's a good thing that we're seeing some, not a good thing, but it's,
right.
Yeah, that we're seeing these people come in and seek out the care that they need. And sometimes that's life-saving care.
It's really interesting. I'm glad you brought that up. I actually have a friend who is a nurse, and that's one of the things that she was saying was that people who are having issues with their heart or, you know, all these other things that they would see on a normal basis have gone down. And she is thinking the same thing. People are afraid. They're afraid to come into the hospital for these emergencies. And that's terrifying, right? So, I mean, if you could speak to the public in regards to that, to relieve the fear, so that if they are having an emergency or they think, you know, whatever the symptoms may be, you know, in regards to a heart attack or appendicitis or, you know, just not thinking about COVID, right? So when we think about COVID, we want to go to our doctor, you know, our urgent cares, and if we're uninsured, we want to go to our free testing sites. So what would you say to the public in regards to those other, you know, serious situations where they may be scared to death to go in? Like I had someone I knew who needed gallbladder surgery, and they were terrified, but they had to have it done, right? So speak to that a little bit.
No, yeah, and it's, I mean, rightfully so, and nowhere would I tell anyone that they're wrong for feeling the way that they feel. I will say that, you know, we have a system in place and we have trained professionals in our ERs to take care of situations like this. And I would never encourage anyone from not seeking out the care that they feel like they need to seek out to protect themselves. You know, and that's really important right now, is that, you know, not only is it life-threatening potentially, but the lasting effects that has, you know, that if somebody feels that tightness in their chest and they don't seek out the care that they need, you know, what that does to, you know, to their overall health, you know, in the long run. You know, and so it's a difficult time. You know, the emergency rooms are dealing with this pandemic and doing all that we can. But, you know, as providers, we recognize too that that's not our only job, and that we need to make sure that there's, you know, the world doesn't stop turning, that we still have other issues that we have to take care of. And it's the job that we signed up for, and, you know, and it's a job that we're ready to do. You know, I say it all the time, and it's why I love being a legislator and a nurse. You know, my number one priority is to have positive outcomes for my patients. And I do whatever I have to do. And I take great pride in the job I do as a legislator, because I know that the work that we do down at that Capitol affects our patients and affects their outcomes too. And you know, we need to make sure that we fight for them. And I know Yadira feels the same way when it comes to her patients.
You know, so before we take questions, I do want to do a quick thank you to all the healthcare workers out there that are definitely putting themselves on the line, taking care of all of us. And I definitely want to thank you both for everything that you do every day. And to be, you know, I just want you to be safe as well, right? And thank you so much for being here tonight. So why don't we go through the chat, and want to have you both look at the chat. And in the meantime, I want to welcome Representative Matt Gray. Hi, Matt. Thanks for joining. I think you know your colleagues here.
I have met both of them, it turns out.
Look at that beard, Representative Gray. I'm loving it.
It's the COVID look. So let's see here. Let's look at our questions. And I think some of these are actually directed to each of you. So
if you want, I can start with Sherry's questions. It looks like that's one of the first ones.
Yes, please.
And those are specific to kids, so I think those are for me. I was actually, Sherry, that's what I was looking up as Kyle was talking, to see if there was a breakdown that the AAP had about the 97,000 kids who it turns out have been just over the last 2 weeks. I misspoke. I thought it had been over the last month. And they don't have a breakdown on their website in terms of how many of those were less than 10, but I'll keep looking for that. The reason that they don't transmit as well is nothing to do with their hand hygiene, which is, as you said, usually pretty terrible. And I call them little petri dishes, but it has more to do with their physiology. They're not good at coughing when they're less than 10. And this kind of relates to a question that comes later down in the chat in terms of whether this is transmitted by droplets or aerosols. That you would think would be a simple question to answer. And that's another thing that has shifted as we've learned more about this. We really thought these were droplets, so really big, heavy particles that you cough them out, they land on a surface, and I just scared the living daylights out of my cat by doing that. But they land on a surface, you touch it, you touch your nose, you eat something, and now you've got it. Turns out that this is probably much more aerosolized than we thought. So when kids cough, they don't do that. If you've ever seen those videos, that big spray of 10 to 20 feet that we do as adults when we cough and we sneeze, they're not good at doing that. And so they don't spray as many particles out. And then the last question that she said is, will children need to be vaccinated? Yes. So the reason this is called a novel coronavirus is it's brand new. None of us have ever seen it. That's why we're all, at risk for this. And so every single person will need to be vaccinated in order for them to fully protect themselves against this illness. Because children are doing so well, I anticipate that they're going to be the last ones to see this vaccination. The first are probably going to be people who are in really high-risk jobs, so healthcare workers being one of them, and then is probably going to be people over the age of 65, in particular those who have another condition, so lung condition, heart condition, diabetes, and then we'll probably go down the line of adults and children, except for those who have very serious illnesses, are probably going to be the last in line, but they definitely will all have to be vaccinated.
Thank you. That was great. Thank you so much. Kyle, did you see any questions that were
So Sally, there usually comes a time when I do a town hall with Dr. Caraveo, and I've held my own this whole time, where I can't really follow her because she just blows me out of the water. And so this is probably the longest I've lasted where I've held my own and really can add nothing to what she said, because she is super intelligent, and we're lucky to have her. And I think she really answered all those questions perfectly. And she's just, I can't say enough good things about Yadira.
Oh, thanks, Kyle. You can probably talk about the communication we've been having, and Matt, I'm sure, can jump in here as well, that we've been having with our congressional delegation. It looks like Virginia wants to know about what conversations we've been having with them and how what we've been urging them to do at the federal level.
Do you want to jump in, Matt?
Sure, why not? Hi, everybody. Our congressional delegation, our members of Congress have felt a little stymied. Like we've talked to them a few times, but there's a lot of gridlock at the federal level. That's not news to anybody. But it's really unfortunate. It's always unfortunate, frankly, but it's really unfortunate right now at this moment in a pandemic where we need more assistance. A lot of the assistance that has been granted has expired in recent days. But we've also seen we're not at the end of this yet. And so we both need, again, I cannot talk about the medical needs nearly as well as Representatives Caraveo or Mullica can, but across the economy and across the other things that we need, we're just in a place right now, especially as Colorado lawmakers, we are really hamstrung by our Constitution and our ability to spend a bunch of money that we don't have. The federal government has the ability to spend a bunch of money that they don't have. We don't. We are constitutionally required to balance our budget, and had to cut our budget, not expand our budget. And so in a lot of ways, we're very dependent on the federal government being able to come in and provide aid during really hard times, because we have to spend less during hard times, even though that's generally where you'd want folks to spend more for relief. So we get periodic briefings, but right now, basically our delegation, the last time they said they were going to talk to us, had to cancel it because they didn't have any progress report. So it's not a bad time to contact your federal member of Congress and say, you'd like to see action. The emergency is far from over and there's things to do, because right now progress isn't really being made, and obviously the needs are still there in our community.
So Representative Gray, along those lines, can you speak a little bit to how this is affecting, say, like Health First Colorado? You talked about how there were cuts to a lot of these really important programs. Talk about that. Has it affected Health First Colorado? Has it affected CHIP? And are we able to utilize these resources for the people that need them in regards to this pandemic? Or do we really we need to get more help from the federal elected officials to trickle down those dollars? But are we, what's happening right now in regards to that?
Sure, I can't speak to, and I don't know if either Rep. Caraveo or Mullica can speak to Health First Colorado specifically. I can't speak to, I don't know exactly what they do or where they are. I will tell you things like one of the issues that I've been following along with for years has been our inability to deal with our Medicaid waiting list for adults who are on that waiting list. And it's something we're making progress on, and we're sort of carving bit by little bit on, but never really succeeded at. And then this last budget year has just devastated us. So the answer is almost nobody, unless you're in a really specific area that happened to be right in the sweet spot of where CARES money came from, is doing better than they were before. And not all of that is federal. Like from the state level, it's been nothing but cuts because, again, we had to cut $3 billion out of the budget, and our budget wasn't doing great before. Like we were failing a lot of people from before. And like, again, they're both medical providers. I'm a financial side guy. Like I've been working on being a finance nerd for a long time and trying to help close our gap between where we should be and where we are. But we've taken a few steps forward and took 45 steps back when the economy collapsed. But that's a lot of the answer. The answer is almost anything that relies on state funding is hurting right now. And that's a lot of stuff in the medical area. It's also a lot of stuff, whether you're a para-retiree, whether you're, a teacher, a student, you name it. We had to cut a whole lot of stuff from a whole lot of people, and filling that hole, while Rep. Caraveo and Rep. Mullica are off healing people, like I'm off being a financial nerd and trying to figure out ways to fill that hole, because you can't actually provide medicine or education or anything else that we do without having funding for it.
And along those lines, I mean, we were in a crisis when you were trying to balance the budget this year. And I think, if I'm correct, it's going to be even worse next year.
No, that's right. I mean, we get our projections, but our projections from next year are worse. And a lot of that is because, it comes full circle to the start of this question, which is we had a really bad budget year this year, but a lot of it was backfilled with federal money, especially like school districts, and other local governments. But that's not on the table right now. And the folks who do our financial forecasts don't expect us to be recovered for the 2021-2022 fiscal year at all. And so right now we're still looking at the edge of a cliff. We were lifted up a little bit by the last round, but we were able to avoid some of the horrible cuts. But yeah, no, everything they are preparing us for is for next year to be worse than this year. And, the major fiscal initiatives that would have offset some of that, Initiative 271 being one of them, didn't make the ballot. And so we're looking at a pretty dire place. Again, we have some hope there. There are folks in Congress who are working on providing assistance to, state and local governments that would help to offset that. And if that passes, then that could offset some of it. But right now, going back to where we started, it's at a stalemate right now. And so we are like staring at the edge of a cliff, even beyond where we are now.
Yes, but do those federal dollars have to go to new programs, or can they go to existing programs?
It depends on what the federal government says. I mean, some of them have been yes, some of them have been no, but frankly, the dollars that have been allocated from the 2020 CARES Act, the one that was previously passed, are pretty much baked into the equation at this point. So to do anything to help for next year would require a new bill, and what strings are attached to that money, we won't know until we see it. So the answer is hopefully no, but we won't know until they actually say it. But basically, everybody who's getting 2020 CARES Act money is generally allocated already. It's not been enough to take care of everything. But as far as next year's budget picture goes, we won't know until we see a bill, and right now they're having a really hard time coming up with one.
Okay, thank you, Representative Gray. I really appreciate that. Representative Caraveo, can you speak a little bit to the Health First Colorado and then also CHIP? Thanks.
Sure. So as Representative Gray said, exactly when we should be spending more as a state to take care of all our vulnerable populations who are going to be taking advantage of these social programs that we have for them, that's when the state has to cut back because we don't have a big reserve. And so Health First Colorado, which is Colorado's fancy name for Medicaid, is seeing a huge increase in enrollment. We don't know the exact numbers yet, but we're expecting 500,000 new people being added to the rolls, and the state has to pay for part of that. Part of that comes from the federal government, but next year we're going to have to figure out how to balance a budget where we are providing more of the health care for the most vulnerable people in Colorado, while we are seeing overall a need to cut the budget across the board. We already made some really difficult choices this year. We literally, the JBC had to consider whether, which is the Joint Budget Committee, whether they were going to eliminate state funding for CHIP, the Children's Health Program. They made other tough choices so that they wouldn't have to do that. But I don't think I will ever forget seeing analysts from the Joint Budget Committee who were very analytical people presenting on things like cutting CHIP and crying because they knew what the effects were going to be on Coloradans. So it's that we've got a lot of difficult choices because we've got to make some cuts exactly at the time when we should be helping people out the most.
Wow, it's so disheartening and incredibly challenging. Well, we definitely will have our work cut out for us, right, in 21. Kyle, do you want to speak to that? Do you have anything to add?
I felt like a lot of it was spoken about. We're going to have a really rough year coming up, and we were able to really get through this last budget by making one-time cuts, and so we would find one-time pools of money to really fill in this budget. And I think what's scariest for me is that those will not be here this next time. And what does that mean? And so, it's going to take a lot of hard work, and it's probably going to be, I can't speak for Matt, but probably going to be the hardest session that any of us have ever had to deal with. It's going to be really difficult, and we just, I feel like I'm being pessimistic, but I'm
But it is reality.
It is reality. And,
it's time. I mean, as Coloradans, it's time to get real, right? I mean, we are in a pandemic. We weren't ready for this, and now moving forward, it's critical. So, yes. It's important that we're real with people, right? And we're authentic. How else are they going to really understand the how critical this is that we're dealing with? So there isn't a magic, well of money that we have stashed away. So I think it's important, right? So well, we're out of time, and I wanted to basically thank you all for being here. I mean, this has been a great discussion. I think it's been really informative. And again, so great to have Representative Gray here. Did you want to say something, Matt, on a closing?
Sure, I would just say, for those of us, we look forward to welcoming Sally to the state Senate. When we can, but for those of us who've been there and spent time down there, I don't have the kind of health experience, obviously, not the kind of health experience of actually being a doctor or being a nurse, in that I have been to the doctor before. But the policy decisions that are made are by the people who show up and the people who are there. And I don't get overly political, but there are folks in the building who, in staring down the face of this pandemic, want to pretend it doesn't exist. Like, that's just true. We deal with it. We deal with it both on Twitter, all that stuff, or what have you. We also dealt with it when we were in the room, when we were in the building. And if these issues are the issues that are important to you, the decisions are made by people who show up, and the people who show up are the people who get elected. And so I'll just take a moment to make a plug both for helping to elect Sally, but also Kyle and Yadira as well, that, all three of them are up for election right now. And this is a great time to show your support, because the best way, unfortunately, we don't control everything as a legislature, right? There's a lot of other folks who have a lot of control over that. But for the things we can do, and for the improvements that Rep. Caraveo and Rep. Mullica have already made to our public health systems, and the stuff that future Senator Sally can make as well, we need your support for the electoral side of that as well. So if you can support any of the three of them, or maybe all three of them, now is the time to do it. This is a weird election year because it feels like everything is just on pause. But we're about 2 months away from people starting to vote in this election. And so if you're in a position where you've heard what you need to hear to know that these are folks you should support, and I will tell you, I've gotten to know Sally recently over the last few months, but I've also been in the trenches in a significant way with Yadira and Kyle, and they're two of the most fearless lawmakers that I have ever worked with, and very proud to stand beside. So if you have the means and you're doing okay and you have a chance to make a financial contribution or share some of your time, these are the people to do it with. I'd love for Sally to be my senator, and I don't know what I would do if Yadira and Kyle weren't my colleagues. So please take the time to support them, and and make sure that they get elected, and make sure that we have them there to make this is not going to be over in January of 2021. We're going to need serious policymakers to deliver in our next legislative session. And these are three, in my boxes, the ones right here, these are three very serious policymakers, and please do support them today, support them as much as you can, because we need them very, very badly.
Thanks so much, Matt. I mean, such an honor for you to even come by. I know how busy you are too. And thank you so much. I look forward to being your senator, but also working as a colleague, right, with all three of you. There's so much work that needs to be done, and we're very fortunate to have professional healthcare people who are our legislators as well. So you bring a lot to this discussion, and I appreciate you. Thank you all for being here tonight and for your questions. They were so engaging, and have a wonderful evening. Thanks so much. Bye.
Bye, everyone.